Now that we understand pharmacokinetics, there are considerations we need to keep in mind that may interfere or otherwise influence this process. Enteral medications use the gastrointestinal tract. These are primarily oral medications. Circulation from the GI tract brings things absorbed through the system directly to the liver. This is called portal circulation. In this case, medications are metabolized by the liver before they are able to be distributed throughout the body. This is known as the first pass effect. Because of this effect, enteral medications must either be prodrugs or stronger versions of the medication than would otherwise need to be used, so the liver cannot completely inactivate the drug before it's distributed through the body. Parenteral medications avoid the gastrointestinal tract. Injections, topical medications, inhaled medications, and IV medications are all examples of parenteral medications. These medications are absorbed in a place that does not enter portal circulation first. Because of this, they are not impacted by the first pass effect. Rather, they move throughout the body before they are taken to the liver to be metabolized. Toxicity occurs when too high levels of a drug hit distribution at one time. This can cause significant negative effects for the patient. This happens when a dose is too high, when a patient's liver is compromised and the drug is not metabolized as expected, or the patient's kidneys are compromised and the medication is not excreted as expected. Deficiency occurs when too low levels of a drug are available for distribution, causing a lack of physiological effects. This occurs when the medication dose is too low, or the patient is metabolizing it at a much higher rate than expected. Altered health status can also impact absorption rates, leading to deficiency. Interactions are complications that can arise when a patient takes drugs that interact with each other. It is essential that the healthcare providers know all the drugs a patient is taking, including herbs, supplements, vitamins, and any over-the-counter medications. These interactions can be severe and can even be life-threatening. For example, taking alcohol while on an opioid drug can lead to life-threatening respiratory depression. Taking aspirin with St. John's wort could lead to life-threatening bleeding problems. It is also concerning when multiple drugs are taken containing the same substance. The most common and one of the most deadly overdoses we see in the United States is a Tylenol overdose. Many combination drugs contain Tylenol, and patients generally consider Tylenol safe and do not closely monitor their dosage. In fact, over 25,000 hospitals due to Tylenol overdose occur each year. Many of these overdoses are unintentional. All of them are preventable. Contraindications are conditions that, if present, the patient should not be given a specific medication. These are generally disease, disorder, or pregnancy related. For example, a patient with a history of GI bleeds should never take ibuprofen due to the blood-thinning nature of the drug and the risk of future bleeding. Side effects are generally mild, meaning that they're not often dangerous. The patient will continue to take the medication if they can tolerate the side effects. They will stop the medication if they cannot tolerate the side effects. Examples of common side effects are nausea, headache, or dizziness. These can often be minimized by small changes in the patient's routine, such as diet or activity level. Patients need to be well aware of the more common side effects and advised that they may need to make these changes, such as eating with medication or avoiding driving because of fatigue or dizziness. Adverse reactions are more serious side effects. If a patient experiences an adverse reaction, they should stop taking the medication, not take it again. Examples of adverse reactions are excessive vomiting or respiratory depression. An allergic reaction occurs when a patient's immune system recognizes the drug as a pathogen. Since drugs are designed to enter the bloodstream and travel all throughout the body, an allergic reaction from a drug will cause a systemic inflammatory response. This response may be mild or severe. In severe cases, this can lead to respiratory distress, increase in pulse, decrease in blood pressure, and is a life-threatening condition. If the patient has even mild allergic reaction, they should never be given that drug again, because subsequent exposure will often lead to more serious reactions. All the drugs we use, we expect to have specific effects. This is true of recreational drugs, pharmaceutical drugs, as well as herbs and supplements. An individual will take a drug expecting it to do something. This expected outcome is often seen as the benefit of the drug. Any drug strong enough to provide a benefit is also strong enough to impact other body systems that may not necessarily be intended to impact. This is known as the risk of the drug. If a medication has no risk, there will be no benefit. This is due to the fact that if the drug is strong enough to produce a benefit, it is strong enough to produce risks. For example, if a muscle relaxer is taken to relax the skeletal muscles after trauma, it will also relax the smooth muscles and may cause constipation or hypotension. If a medication is taken with the expectation that there will be no side effects, there should also be the expectation that it will not be strong enough to have any substantial benefit. Patients must know all the benefits and risks of any medication they take so they can determine if the potential benefits are worth the potential risks. Because of this, clear and correct patient education is essential. These risk versus benefit discussions should be had every time a patient starts or stops a medication, including any herbs, vitamins, supplements, and over-the-counter medications.